The first conference was a really successful experience because the feedback from the participants, the feedback from the tutors was really positive, and it looks like it was like an inspiration for at different levels, either for clinicians or students, and it has a very positive impact on the profession in general. We had a fantastic feedback from the international delegates, everyone has heard about the conference and the contents of the lectures, and all these factors was a fantastic motive and very big motive to help us, or to make us think in a different way. How can we plan for the next conference? How can we make it different in order to maintain the level of success that we achieved on the first Congress? That's why this time the difference will be mainly about the background of the tutors. They are coming from different backgrounds, mainly academic and research background, in addition to their strong clinical background. We'll cover different body parts. We'll look at different concepts, either as a kinetic control or hands-on manipulation, or as exercise prescription, considering the evidence behind all these elements. So we hope that even for those who attended the first conference, it will be a completely different experience, still very positive. And for those who are coming to the conference, to the second conference, as a new participant, it will be an inspiration, and it will be a very effective experience to help them to develop themselves clinically and to get better results with their patients.
We set high standards for the recruitment of the keynote speakers to fit the specific aim of the second Orthopedic Manual Therapy Congress.
Our slogan for this year is closing the gap between research and manual therapy practice. Our main aim is to introduce clinical lectures supported by research evidence and introduced by international experts.
The gap between research and clinical practice was the reason that attending conferences wasn't the priority of many of our colleagues, and their focus was on attending practical courses.
During the second Orthopedic Manual Therapy Congress, journey of patient assessment and treatment will be covered, starting by ensuring patient safety, passing by full treatment plan based on evidence.
Which will be a great opportunity for a limited number of participants to apply what they have learned from the Congress in practical environment.
Waiting for your participation at the second Orthopedic Manual Therapy Congress, 15th and 16th of February 2019, Cairo, Egypt.